Testosterone replacement therapy and prostate blood testing. This is part 2 in the series. Today, we're going to talk about how to ensure that you get the most accurate blood test possible. So, one thing you should know about the serum PSA test is that it does have a half life of roughly about 3-ish days. I've read some studies, some reports that say it's about 2 days, but all in all, for nomenclature, for this purposes, let's say 2 to 3 days, since that seems to be about the consensus. Anyway, with that being said, anything you do within that window could possibly falsely elevate it. Now, when I say things that could do it, I'm talking about vigorous exercise, lifting weights, things like that could falsely elevate the PSA. Ejaculation is another one. I typically tell most guys if we want to get an authentic, a genuine, realistic baseline understanding what your true PSA looks like, let's avoid ejaculating. Let's avoid any kind of vigorous physical activity for at least, let's say, at least about 3-4 days, just to be on the safe side. Now, for some of our clients they do recreational cycling, road biking, mountain biking, things like that, it's not unheard of for me to tell them to hold off on it, for the first week prior to getting your labs drawn. Again, even though the PSA has a half-life of roughly about 2 to 3 days, it could still be extrapolated that 3-4 half-lives could exceed almost to that, beyond that week. Another thing to think about the PSA is that if you are going to a physical exam, the prescriber, the provider, whoever you're seeing, they should draw your serum PSA blood values prior to doing a digital rectal exam, because if they do the digital rectal exam first, it could falsely elevate the PSA. Even taking a very strenuous, hard bowel movement could spike the PSA a little bit. Now, on the contrary, there are a few things that you should take into consideration that could possibly falsely lower your PSA values. One of the more common things we see that can falsely lower your PSA values is if the patient is obese or if the patient has a larger body mass, a larger frame. And this is because when you're simply bigger and you carry more mass, there's going to be a lot more fluid. There's going to be a higher level of intravascular volume. So what that means is having more intravascular volume is going to have more of a dilutional effect on the PSA that is in your serum. This is no different than, let's say we have a shot glass, okay, and we fill it with water. Now what we do is with that shot glass, we'll pour 4 drops of red dye in it. Well, it's a small space, so that red dye is going to disperse and it's going to fill that shot glass quite well. Now let's say we have a cup, an actual cup, and we put a few drops of red dye in it. It's not really going to affect or change the color of what's in the cup because it has a dilutional effect. So similarly, you can find that dilutional effect in larger patients and people with bigger body masses, and that can lower their PSA a little bit as well. In addition to body mass size being a possible dilutional reduction in your PSA, medications also can negatively impact your PSA, meaning medications can lower it. Some of these include like the NSAIDs, such as like meloxicam, ibuprofen. Those are included in the list. Thiazide diuretics. One of the most popular thiazides would be hydrochlorothiazide, or HCTZ for short. That one's commonly prescribed for people with hypertension, oftentimes as a first line or second line adjunct medication. Acetaminophen, which is also known as Tylenol, can also lower the PSA values. And another commonly prescribed class of drugs that can lower the PSA include the statins. So Lipitor, Crestor, so rosuvastatin can do it. Livalo could do it. Any of those drugs could do it. And another class, and this, I want to expound on this one a little bit more, would be the 5-alpha reductase inhibitors, particularly finasteride and dutasteride. So those drugs inhibit an enzyme called 5-alpha reductase. And by inhibiting that enzyme, you're inhibiting testosterone from converting to DHT, which is dihydrotestosterone. Now, if you are on 5-alpha reductase inhibitors, which are commonly prescribed for hair loss, as well as BPH, it can lower your PSA up to 50%. In fact, if you are on a 5-alpha reductase inhibitor for at least 6-ish months or more, the literature even supports that when you draw the PSA, you multiply it by 2, because that would be the anticipated, expected true value of what the PSA would have been had you not been on the 5-alpha reductase inhibitor. Thanks for watching. If you enjoyed this video, found it informative, give us a subscribe, give us a follow on Instagram and or TikTok as well. We appreciate it. So y'all have a great day.